I'd like to introduce you to Anderson Health Systems and the Smart Health Glucose Meter. My name is Daniel Lopez, and please accept this electronic brochure as my replacement. Prior to the COVID outbreak, I planned on scheduling face-to-face meetings throughout the USA, meeting with larger suppliers like yourself, whom supply mail-order diabetic products to the Medicare market. Anderson Health supplies an assortment of home monitoring products, which includes the Smart Health Diabetic Supply line. This electronic brochure is focused on the glucose meter and the software that enables the prescribing doctor to be reimbursed for using the meter through the new RPM CPT codes. Prior to RPM remote patient monitoring becoming popular in 2020, Anderson business was primarily with the managed care and telehealth organizations. Because of RPM, the healthcare landscape is going through a change, and the diabetic patient is the RPM primary focus. In the next few months, doctors will insist that their patients participate with products that are capable of communicating through the RPM platform. Smart Health Bluetooth Glucose Meter has the SDK built in so to automatically transfer to the doctor's RPM platform, and the RPM platform is also supplied by Anderson Health. The primary doctor as well as the endocrinologist can both benefit on RPM. The unique ingredients that make RPM so popular amidst the doctors is the ability to track the patient's testing results in real time, and the doctor can be reimbursed for the time needed to view the reports. The average doctor has 500 Medicare diabetic patients and can increase their practice yearly income by $600,000 with a small overhead cost of 2 secretarial non-medical employees. RPM will change the way doctors view their patients and also how the patients view their doctors. The practice of testing from home will engage the patient into their health and in many cases will lower their A1C, thus extending the patient's life. Conversions of glucose meters are expensive, and Anderson can help by offering their Smart Health Glucose Meter for $5 when purchased at an 8-to-1 ratio of strips. If the patient signed up for RPM, there isn't any charge for the meter or any of the other supplied testing equipment needed for RPM. The Smart Diabetic Glucose Meter technology is ahead of the competition. All glucose meters are required to follow FDA requirement ISO 150197 accuracy standard and must fall within plus or minus 20% milligrams per deciliter to the clinical lab reading. Our meter measures at 15% accuracy level, which compares closely to the clinical lab test results. This accuracy can cause users to question why our meter may identify test results they are not used to seeing. It is simply a more accurate number than they have been following from their previous meter. When the patient is visiting their non-participating doctor, they can transmit the past 90 days of testing results for the glucose, weight, blood pressure, temperature, oxygen level, and/or activity to the doctor's fax machine or email while the patient is sitting at the doctor's office or from anywhere else. If the patient is type 1, then the report also displays how much insulin was administered at the time of each test. Each quarter, the RPM patients will be sent a new piece of equipment. The assortment of the equipment will enable the user and the doctor to see the bigger picture of their health. The current equipment list is blood pressure cuff, weight scale, thermometer, pulse ox, activity watch, pill dispenser, ECG monitor, and the sleep monitor. In most cases, this full range of equipment will detect bad trends, and the built-in alerts, along with our customer support center, can help the patient and the doctor be well informed. Most people that hear about the RPM program for the first time are baffled on how Medicare can afford to spend more money when the service is predicted to go broke in the next 20 years. Each year, Medicare spends $582 billion on 44 million Medicare recipients. The average cost is $13,000 per person. RPM yearly cost per person is $1,600 and is expected to lower the hospitalization average cost per person by 50%, saving Medicare billions of dollars. Most importantly, the patient can be assisted in bettering their health, and the doctor can be reimbursed for the additional time given to each patient. The doctor's income will increase by $600,000 per year as an average, And if you jump on this program before your competitor does, you could generate a large spike in customers and a large spike in your profit margins as well. When purchasing our diabetic supplies, the software platform is included at no additional cost to you or your doctor. If the doctor wants to sign up the patients to RPM, the cost is $15 per patient per month. Our RPM support includes the welcome call, patient engagement, equipment support, and our exclusive one-on-one support for the doctor's staff. We designed our software and trained the support staff to eliminate the learning curve involved with most softwares. Our support team will watch the office staff in real time through a program similar to Join Me and help them, or they can watch us. We will train them as they work. No downtime required. There are 6 CPT codes that make up the RPM billing program. 99453 is for reimbursement to educate the patient about RPM. 99454 plus 99457 is for the reimbursement of time spent viewing the testing results that is based on 20 minutes or 40 minutes per month. 99454 is the reimbursement for the supply of the equipment and the cost of the software program. And 99421 plus 99423 is the communication between the PA or doctor and the patient separately from the viewing of reports. Anderson Health considers your DME company to be in the perfect position to enter the RPM market seamlessly by firstly asking the patient if they would like to be monitored from home and be given the proper equipment to do so. Then the doctor is approached and asked if their office would be interested in viewing the patient monthly reports and be paid for this service through Medicare. Our staff is happy to assist with the patient or the doctor. All doctors that we have shown the RPM program to in the past have wanted to go forward, and we should have the same results with your doctors. Anderson offers 2 programs for the doctors to choose from on behalf of your DME company. The all-inclusive rental program that costs the doctor $40 per month per patient. If the doctor chooses the rental program, then the doctor would bill Medicare the full $170 monthly fee and pay Anderson Health $40 for the rental and support. All equipment that is delivered to the patient stays with the patient, and the contract is month to month. The other promotion is the shared expense. If the doctor chooses this program, then the CPT code 99454 is billed from a third party and the doctor hasn't any financial responsibility. The doctor can bill for $101 and Anderson Health will bill the CPT code 99454 through a third party that is licensed to bill these codes. Most doctors have chosen the shared service option and not be responsible for any expenses. Smart Health One-on-One software platform has been in use for 20 years and has serviced thousands of patients. The support staff is seasoned and prepared to support the doctor and patients. Our platform can be offered as a standalone product, or we can stand in the shadows and solely represent your company. The equipment can be sent to the patients under your logo, and the phone calls will be supported on behalf of your company if you choose to take the front position. The 4 steps of implementing the RPM program through your established doctor contacts could be approached using a similar electronic brochure as what you're looking at with a follow-up phone call. The brochure is sent to the doctor on behalf of the patient, whom you currently supply. A follow-up call and the delivery of the electronic brochure could be done by our staff on your behalf, or it can be done by your company requesting the doctor's presence for a more detailed webinar showing the features of the RPM program. The doctor will be offered free service for your patient for the first month to test the waters. Once the doctor sees how easy it is to participate in the RPM and how much good it can do for the patient, the doctor will go forward with the average 250 patients. Please contact us by email or phone. Thank you for your time.